Shri Naresh Kumar ji, Chief Secretary, Delhi, Secretary Health, Shri Amit Singla ji, Dr. S.K. Sareen, Director ILBS, experts, excellent faculty who had the occasion to meet as I was walking down to this auditorium. And what impressed me the most was that all those I met were really women. And that is a very rare sight to see. Proof to me what I truly believe in, that women can be multifaceted. They can run a home well, they can do a job well, and what they proved today was that they can cook very well also. It is a great pleasure to be here today, and my gratitude to all of you, especially Dr. S.K. Sareen, for inviting me on your 13th Foundation Day. My thanks to the Institute's valuable support, since you are a WHO collaborating center, which was already mentioned earlier, and for your efforts to strengthen access to quality, affordable care for viral hepatitis and other liver diseases, not only in India, but in Southeast Asia region as well. From Project Prakash to Project Empathy, and onto the Institute's high-level advocacy on the avoidable impact of non-alcoholic fatty liver disease, the ILBS continues to be a beacon of the best science for better clinical and public health outcomes. My congratulations to all of you for this exemplary work, and my sincere hope that for many years to come, you will have high-impact collaboration with WHO, not just to sustain what you have already achieved, but to accelerate momentum to advance liver health and to eliminate hepatitis by 2030. For that, you are aware that last year was particularly significant. First, on the World Hepatitis Day, WHO launched a new global advocacy campaign that focuses on integrating quality, accessible, and affordable hepatitis care into primary healthcare initiative, which for WHO is extremely important today. The campaign is aligned with the region's strategy for primary healthcare, launched in December 2021, as well as the new WHO Global Health Sector Strategies on HIV, viral hepatitis, and sexually transmitted infections for 2020 to 2030. Second, in September, at the 75th session of the Regional Committee, member states unanimously endorsed the region's new integrated action plan on viral hepatitis, HIV, and STI. It's an integrated plan that we have now advocated for. For the first time, this covers all three diseases in one plan, recognizing their common determinants and modes of transmission, and prioritizing equity and innovation, and advocating people-centered and community-driven approaches. And third, in October, we held the first meeting of our new Regional Strategic and Technical Advisory Group on viral hepatitis, HIV, and STI, as well as a meeting of national program managers of the region. I'm pleased to report that both events were a great success and will accelerate action towards our targets that we have set for ourselves, namely, by 2025, to reduce new infections of hepatitis B and C by 50%, to reduce deaths from liver cancer by 40%, and to ensure that 60% of the people living with hepatitis B and C are diagnosed, and to ensure that 50% of those eligible are treated. And of course, by 2030, to eliminate hepatitis as a public health problem. In the months and years ahead, accelerating progress in India and Southeast Asia, as well as the world, could not be more urgent. Globally, nearly 354 million people are estimated to be living with chronic hepatitis B and C, of which at least 20% are from the Southeast Asia region. Every year, around 3 million people newly acquire hepatitis B and C infections globally, of which close to 500,000 are from this region. The Southeast Asia region accounts for nearly 220,000 of the 1.1 million lives lost to hepatitis B and C globally every year. Across the region, just 10.5% of people who are eligible for antiviral treatment know their status, and of them, only 4.5% are on treatment. Of the estimated 10.5 million people with hepatitis C, just 6.9% know their status, of which around 1 in 5 only are on treatment. You will agree, these numbers are as vast as they are unacceptable. However, they contain within them a very important truth, and that truth is that the right policies implemented in an appropriate manner with the requisite courage, fortitude, and resolve, together we can stack up and compound the gains, not just improving but transforming the health and well-being, lives and livelihoods of people, of communities, and countries across the region. For that, WHO is highlighting 4 priorities. Priority 1, that in all countries the need to strengthen political commitment is extremely important. Nothing works without political commitment. 2, to ensure access for all to safe and effective vaccines and drugs and point-of-care therapeutics, the cost of which should be integrated into national health and domestic funding. And as I was talking to Shri Naresh ji on the side, he suggested that we should work together to produce a vaccine for liver cancer, and we will try to work on that together. Third, what is extremely important and sometimes overlooked, which is community engagement strategies to reduce stigma and to increase awareness and testing, especially among populations at very high risk. And that also we discussed, the need for advocacy, the need for awareness, the need to go out into the communities and tell them what is important. Even when I was visiting the food counter, I thought of that how many people really know what is good food for them as far as this disease is concerned. Fourth, designing and implementing services that are close to where people live and work, and which are aligned with people's needs, people's preferences, and people's health-seeking behaviors. I'm pleased to note that India has made significant progress on priorities 1 and 2 in particular. Since 2018, under the National Viral Hepatitis Program, people in all states and union territories have had free access to diagnostics and drugs for hepatitis B and C, which has so far benefited more than 4.44 crore individuals and treated more than 1.74 lakh patients. For this, the ILPS has played a very important role, especially in raising high-level awareness and action, including among parliamentarians, a best practice that can be replicated with great ease in other countries of the region. And I must share with you that Dr. Serene has been stressing this to me regularly, that there is a need, which he said in his speech also today, to involve other countries of the region. And I thank you very much for your offer. We will take it up to see how countries benefit from ILBS. Not just India, but countries around India also. As India continues to accelerate action on priority 3 and 4, the message I want to focus on is the need to increasingly seek out and nurture strong, effective, and durable partnership, especially at the community level. We know that to increase awareness and uptake of hepatitis prevention, testing, and treatment, communities must be communicated with, they must be engaged, and they must be empowered on their own terms. This approach has proven especially successful in HIV, where the paradigm shift from for the community to with the community and finally by the community has become important. I therefore urge all policymakers, program managers to increasingly reach out to, consult with, engage, and empower community-based organizations and other key actors, such as the media, with a focus on reducing hepatitis-related stigma and accelerating demand for testing and treatment, especially among key populations. Similarly, we see that community-based partnerships can help create, support, and nurture hepatitis services that are aligned with and which reflect people's needs, behaviors, and concerns. I put this question to you. The future of hepatitis care in India, in the Southeast Asia region, and the world must be community-focused, based and led, matching the highest level of political commitment with the sturdiest, most robust foundation of grassroots knowledge, power, and action. And that is where the Knowledge Hub will be extremely useful, to really reach out to the local communities. I must commend and thank ILBS for its tremendous leadership in this regard and reiterate WHO's ongoing and unmitigated support. I once again wish this august world-leading institution, Dr. Serene, and the excellent faculty here a very happy 13th Foundation Day and look forward to our onward journey together to continue to apply the best science for better clinical and public health outcomes. Thank you.